"You're just a hospice nurse. Go hold hands." Dr. Adrian Voss said it across the whole fourth-floor ward, loud enough that the ribbon clipped inside her badge meant nothing in that hush. Renata Hale did not look up from the morphine she was titrating, did not let her hands move faster or slower than the drip required, and the only person who saw her jaw go quiet behind her eyes was the old man in bed 4, who had been watching her for 2 days as a soldier watches a door. He would be the one to stand. 6 minutes from the line you just heard, a code would break on this ward that 3 credentialed people froze on, and the woman they sent to go hold hands would run a resuscitation so exact that a dying colonel would push himself upright on failing legs and call her by a rank no chart in this building had ever carried. But first you have to understand how a room full of people decided she was nothing, and how long she let them. It was a Tuesday on the palliative floor of Mercy Branford General, and the morning light came in clean and gold through the tall east windows, the way it did before the heat pressed flat against the glass. The fourth floor was where the hospital put the people it could no longer fix. Renata Hale was 43, medium height, with a calm she wore like a second uniform, and she had worked this floor for 2 years and 4 months without ever once raising her voice. She had a soft, even way of speaking, and steady brown eyes and brown hair pinned back off a face that had stopped being young in a way that had nothing to do with years. She moved through the ward like someone who had decided long ago that the work was the point and the credit was somebody else's problem. Adrian Voss was 36, and the best pair of hands the surgical service had hired in a decade, and he knew it as surely as a man knows the weather. He had come up to 4 to discharge a post-op parked there for a bed shortage, and the moment he stepped off the elevator, he was impatient with the slowness of the place, the dimmed monitors, the low register the nurses used around the dying. He asked Renata a question about the patient's blood thinner, and she answered it correctly and completely, a number, a time, a reason, and something about the precision of it, coming from a woman in soft blue scrubs on the floor, where careers went to idle, annoyed him. So he said the thing about holding hands. He said it for the 3 residents trailing him, and 2 of them laughed, the short, embarrassed laugh of people who laugh because the senior man did. The third did not laugh. Her name was Priya Nair. She was 26, and she had watched Renata's hands on a bad night once, and what she felt now was not amusement, but a small, cold note of being wrong about something she could not yet name. The stakes on the 4th floor were never abstract. There were 11 patients on the ward that morning, 4 of them actively dying, and one of them was a 68-year-old retired school teacher named Eleanor Shaw, whose daughter was driving in from 3 states away and would not make it before noon. Renata had promised that daughter on the phone at 4 a.m. that she would keep Eleanor present and comfortable, that she would not let the morphine take her under before the daughter's hand was in hers. That was a real promise with a real clock on it, the kind the loud men never knew were being kept. And there was the old man in bed 4, Colonel Walt Brennan, 81, lungs failing, admitted for comfort care after a long argument with his own body that he had finally agreed to stop having. He had said almost nothing in 2 days, but he had watched Renata draw up a syringe on the first night, watched the economy of how she held it, the flick of the wrist to clear the air, the way she found a vein on the back of a frightened hand on the first pass in the dark, and something in his old chest had gone very still because he had seen hands move like that exactly once before, a long way from here, on the worst night of his life. He could not place her yet. The face was older, the hair was different, the war was 12 years back and a country away. But the colonel had spent 40 years learning to trust the part of him that noticed things before he understood them, and that part of him was wide awake. He was the one in the room who knew the truth before anyone else did, and he said not a word, because saying things before you are sure is how good men get people killed. You could feel the dismissal move through the ward like a draft under a door. It went out from Voss in a cold line and touched each nurse it passed. Priya, who looked at the floor, Marcus at the desk, who pretended to chart, old Sister Bernadette, who had run this floor for 19 years and who set down her pen very slowly. The hush had a weight to it. It pressed on the back of Renata's neck, and she let it press, finished the titration, capped the line, logged the dose in tenths, and only then turned to face him with an expression so level it gave him nothing to push against. "Anticoagulation's held since 6, she said. "He's cleared for transport." 8 words. She did not defend the floor. She did not explain that holding a hand, done right, was the hardest medicine in the building. She picked up her tray and walked to Eleanor Shaw's bed, and the residents watched her go, and Priya Nair felt that cold note again, louder. Renata had a worn brass challenge coin in the bottom of her left scrub pocket, smooth from years of being turned over by a thumb, and a service ribbon she never wore folded into the back of her badge where no one looked, and a name she answered to in only one part of her life folded away just as carefully. None of that was visible. What was visible was a woman in blue scrubs being told to go hold hands and going. And if you have ever watched someone good get spoken over, watch the room laugh along with the loud man and miss the quiet one who is holding the whole thing together, then you already understand the shape of what is about to happen here, and you belong here for it. So take a second and subscribe, because this channel exists for exactly those people and exactly that turn, and the ones who follow it are the ones who would have seen her first. So she went to Eleanor Shaw and she sat because the daughter was still hours out and the morphine could wait 20 minutes and the woman was awake and afraid. She took the schoolteacher's hand. Yes, she held a hand exactly as ordered, and there was nothing small about it, and said, "Your girl's on the road, 40 miles out. She's coming." Eleanor's fingers tightened. "I taught 4th grade," the old woman whispered, the way the dying drift back to the thing they were. 41 years. "Then there are people all over this state," Renata said, "who can read because of you." It was not a line she had practiced. It was simply true, and she had a gift for finding the true thing and saying it plainly. And Eleanor Shaw closed her eyes and breathed easier. And across the ward, Priya Nair watched the nurse the surgeon had just humiliated do the one thing none of the residents trailing him knew how to do at all. Hold the question that is forming in you now, because the rest of this is going to answer it. How does a hospice nurse on the floor where nothing happens come to move her hands like a woman who has worked under fire? And what becomes of a room full of people who decided she was nothing on the day the room finally needs the very thing they could not see? To understand Renata Hale, you have to go back 12 years and 4,000 miles to a forward surgical unit the maps called by a coordinate and the people inside it called the Tin Church, because it was a converted chapel with a corrugated roof that rang like a bell when the rounds came close. She had been a captain then. She ran trauma in that unit for 14 months, senior nurse on a team that took the wounded the helicopters could reach and the ones they had to go out and drag back, and she had been very, very good at it. Good in a way that gets talked about in low voices for years afterward. Good enough that they had given her a call sign, Lantern, because she was the one you wanted lit in the dark when everything else had gone to hell. She did not talk about any of that now. She had folded it away as you fold a uniform that no longer fits the life you have chosen, with care, in tissue, where the moths can't reach it. The challenge coin in her pocket was from the Tin Church. One face carried a stylized oil lamp, the reverse, 3 letters and a number that meant something to perhaps 40 people still living. She turned it over with her thumb when the floor got hard. That was all anyone would ever have seen. What sent her from the trauma bay to the hospice floor was not failure and not burnout, though both of those were near the road she took. It was a man named Sergeant Del Okafor, who had died in her hands on the floor of the tin church with the roof ringing, and who had said to her in the last clear minute he had, "Don't let it be like this for everybody. Some of us ought to get the good kind." She had not known, that night, what the good kind was. It had taken her years and a long quiet to understand that he meant the death where someone holds your hand and tells you the true thing, and you go out present and unafraid, and that there was a whole branch of her profession devoted to nothing else, and that she had the steadiest hands in any room for it. So she had left the war and trained for hospice deliberately, as one chooses a penance and finds it is actually a calling. The loud men would never have believed that the woman they sent to go hold hands had chosen the holding on purpose as the harder and more honorable of the two skills she owned. It is worth staying in the tin church a moment, because the night made her, and you cannot understand what she became on the hospice floor without standing once in the room where it was forged. The first round had come in just after the light went, close enough that the corrugated roof rang like the inside of a struck bell, and the dust came down from the rafters in a fine gray curtain. Then the wounded came, faster than the team could sort them, the helicopters bringing in what they could reach, and a ground patrol dragging in the rest on litters slick with the dark. 11 in under an hour. And then the second wave, and the unit's only surgeon, a careful, gifted man named Doc Reyes, whom Renata loved the way you love someone you have bled beside, went down himself with shrapnel through the meat of his shoulder, and the careful, gifted hands that were supposed to save these 11 men were suddenly clamped white around his own ruined arm. That left a captain. That left her. She has never, in 12 years, described what she felt in the half second she understood the room was hers, because there are no words for it that are not a lie, and she does not tell lies about that night. She only knows what she did, which was the next necessary thing, and the one after that. She triaged in the dark by the feel of a pulse and the sound of a breath, because the generator was guttering and the overhead lights came in stutters. She sent the ones who could wait to the corners and pulled the ones who could not under the one good lamp. She lost 2 in the first 20 minutes, a thing she carries and does not set down, and she saved the rest by being faster and steadier than the chaos, by refusing to let her hands shake while the roof rang, by keeping a flat, calm voice running over the noise so that frightened men kept breathing toward the sound of it. And when she got to the officer with the femoral wound and the clamp skittered off the table into the dark in a blast of dust, she did not waste a second looking for it. She put her bare fingers into the wound and found the artery and pinched it shut, and she held it, and she talked. She told him about the lamp on her coin. She told him the war would not have him tonight. She held a torn artery closed with her own hand for 10 minutes while a one-armed surgeon dragged himself back to the table and scrubbed in, and together they saved the leg and the man's name was Walt Brennan, and he did not forget the voice, ever, though it would take him 12 years and a failing pair of lungs to find it again. But the old colonel in bed 4 had been there for all of it, and he just hadn't placed her yet. The face on the hospice floor was older. The hair was different. The light was wrong. There was no ringing roof here, no guttering lamp, just clean gold morning through tall windows. But he was getting closer, like a name surfacing on the tip of your tongue, and his old heart knew before his mind did. He lay in his bed and watched the nurse work, and twice he opened his mouth to say something, and twice he closed it, because the thing forming in him was too large to risk being wrong about. The morning ground on his hospital mornings do. Voss took his residence and his discharge and went back down to the surgical floor where the action was, and the 4th floor exhaled and went back to its slow, exact work. Renata gave Eleanor Shaw her morphine at the right minute and not before, and the school teacher drifted into a calm half-sleep with her promise intact, and the daughter was now 20 miles out. Sister Bernadette found Renata in the supply room and stood in the doorway a moment and said in her dry way, "He's young." "He's good," Renata said, restacking gauze. "He's good and he's young, and those don't cancel." Bernadette almost smiled. She had been a nun before she was a nurse, and she had a long memory, and she had noticed over 2 years certain things about Renata Hale. How she checked exits without seeming to, how she could tell from a doorway which patient was about to crash, the coin she turned over, the ribbon-shaped outline worn into the back of her badge. Bernadette had never asked. Some doors you let a person open themselves. But she knew there was a room behind this woman, and she knew it was a large one. If you watched Renata Hale work an ordinary hour on that floor, and you knew what to look for, you would have seen the whole hidden resume written in the small motions. You would have seen her enter a room and check the patient before she checked the chart, because charts lie and bodies don't. You would have seen her read a respiratory rate from the doorway without seeming to count, as a mechanic hears a bad bearing under a running engine. You would have seen her thread the impossible needle. The floor demands a dozen times a shift, enough morphine to take the pain, not so much it takes the person, adjusting intense, watching the face, never the clock. You would have seen her handle a family as she handled a wound, find the bleeding, apply the pressure, say the true plain thing. The residents trailing Voss had passed every examination medicine could devise, and not one of them could do what she did in that ordinary hour, because what she did is not on an examination. It is the thing you learn in a place that rings like a bell, and then spend 12 years refining on the floor where no one is watching. The tragedy and the engine of the whole story is that the people best equipped to recognize her skill were the ones least willing to look for it on a floor they had already filed under nothing. And the mockery did not stop with one line on one morning. That is not how it works in an institution. It came in smaller, steadier doses after Voss left, the way the loud world keeps a quiet person in her assigned place. A second surgical attending, a brisk woman named Dr. Lindqvist, who came up that afternoon to check on a transfer, called the floor the departure lounge within Renata's hearing and did not lower her voice, because there was no one on this floor whose opinion she imagined mattered. A hospital administrator doing rounds with a clipboard referred to the palliative beds as low acuity 3 times in one sentence, a word that meant, underneath, that nothing important happened here and no one important worked here. The pharmacy tech who delivered the cart joked that 4th floor orders were the easy route, no one's keeping score up here. Each of them was an ordinary person, none of them a villain, every one of them simply confidently wrong, and every one of them was telling Renata Hale, without knowing it, the exact reason a machine could hide on this floor for 6 months and kill people in the open, because no one was keeping score up here. No one except a woman who counted in tenths and forgot nothing, and who was, at that very moment, beginning to keep score. She let all of it pass over her as she had let the morning's insult pass, not from weakness, but because she had buried men and the opinion of Dr. Lindqvist did not rate. There is a freedom in being underestimated that the people doing the underestimating never suspect. The space they concede to you is space to work unwatched. The loud world, busy being important on the floors where things happened, left Renata Hale entirely alone on the floor where nothing did, and alone was exactly what she needed to be to see the thing none of them could see. They had handed her, without meaning to, the one tool that would undo the very machine they were protecting. She turned her coin over once and went back to the floor, and the floor had already begun, days earlier, to tell her something true that she had only half heard. There had been a smaller sign already 3 days before that no one but Renata had read correctly, the first hairline crack in the floor's false calm, though only she had felt it. A patient in bed 2, a frail woman named Delgado on a heparin drip for comfort, had developed a slow ooze from an old IV site that the night nurse had written off as nothing, the kind of minor bleeding the dying do. Renata, coming on shift, had looked at the gauze and the woman's gums and the faint new bruising along her forearm, and had not written it off because a slow ooze in 3 places at once is not nothing. It is a number drifting out of range, and she had pulled the labs herself and found the woman's clotting badly over-thinned and had caught it and corrected it before it became a bleed that killed her. At the time, she had filed it as a one-off, a dosing error, the kind of thing that happens. She had not yet connected it to anything, but it had lodged in the back of her mind the way a wrong sound lodges, a single data point with no pattern around it yet, and when the pattern finally arrived, it would arrive already carrying Delgado's name. The floor had told her something true that day, and she had half heard it. The loud men had not heard it at all, because they were not on the floor, because nothing happens on the floor, because the floor is where you go to hold hands. By 11, the heat had come up, and the ward had settled into the false calm of a held breath. Priya Nair, still turning over that cold note from the morning, drifted toward bed 4, where the old colonel lay propped on 3 pillows watching the door. She checked his oxygen, which did not need checking, and he let her, and then he said in a voice like gravel run through a sieve, "That nurse, the one he talked to." "Renata," Priya said. "Hale." The colonel's pale eyes moved to her face. "Watch her hands," he said. "When it gets bad, you watch her hands." Priya did not understand what he meant, and she said so, gently, as you talk to the dying when they wander. The colonel almost smiled. "It's going to get bad," he said, "and you'll see." It was not a wander. It was a forecast. The man who had spent 40 years trusting what he noticed before he understood it had noticed something, and 10 minutes later the floor proved him right. It started, as these things do, with a sound that was wrong. In bed 7, a man named Howell, 62, admitted for end-stage cardiac failure but stable enough that morning to be eating gelatin, made a noise that was not a cough and was not a word, and his monitor threw a tone that cut through the ward's hush like a wire. Renata was already moving before the alarm finished its first cycle. She had heard the wrong sound a half-second before the machine did, as she had heard wrong sounds for 14 months in a place that rang like a bell. And she reached bed 7 to find Howell gray and pulseless, eyes rolling, a clot or a rhythm or a rupture, no time to know which. "Code," she said, not loud, the trained voice that carries without rising. "Call it, now." And here is where the morning turned, because the people who were supposed to run this froze. Marcus at the desk hit the code button and then stood there with the phone in his hand, his training gone white in his head, as it goes for everyone the first real time. The resident still on the floor, a young man named Foley, whom Voss had left to finish paperwork, came at a run and then stopped at the foot of the bed, because there is a specific terror that takes a credentialed person who has passed every test and never had a body actually dying under their hands, and Foley met it now and could not move through it. Even Sister Bernadette, 19 years on the floor, hesitated half a beat, not from fear but from the floor's whole culture, which was about letting go, not hauling back, and the gears took a moment to switch. For one suspended second nobody did the next thing. The held breath of the morning hung in the air, and you could see it hang, like dust suspended in a shaft of window light. Every mote stopped. Renata Hale did not stop. She had Howell flat and the headboard off and her interlaced hands on his sternum before anyone else had crossed the room, and she found the depth and the rate on the first compression 110 a minute, 2 inches down, the count running under her breath like a prayer she'd said 10,000 times. "Foley," she said between compressions, not unkindly, "bag him. Now, you can do this. 2-handed seal. Watch the chest rise." And the sound of her voice doing the impossible thing calmly cracked the young resident out of his freeze, and his hands found the bag valve mask and he sealed it and squeezed and the chest rose. "Good," she said. Again, with me, she did not look up. Marcus, crash cart, pads, move your feet. Marcus's feet moved. The room came unstuck around the one person in it who had never gotten stuck, and it came unstuck because she ran it, not with rank, not with volume, but with the flat certainty of someone who had done this in far worse rooms and knew, in her hands and her breath, exactly what the next necessary thing was, and the one after that, and the one after that. Priya Nair, pulling the crash cart, looked at Renata Hale's hands and remembered the old colonel's words from 10 minutes before and felt the hair come up on her arms. What Priya saw in the next 4 minutes she would never be able to fully describe to anyone who had not been there. She saw a hospice nurse go hold hands, run a resuscitation with the unhurried speed of a metronome. She saw her read the rhythm off the monitor the instant the pads were on, call it as a shockable rhythm in a voice with no doubt in it, clear the bed with a glance everyone obeyed, and deliver the shock. She saw her resume compressions in the same breath, never losing the count, calling the 2-minute cycles, calling the drugs by dose and route, running a code by the book so cleanly that it looked less like an emergency and more like a difficult piece of music played correctly. The ward, which had been a place where nothing happened, became for 4 minutes a place where everything happened, and at its center was the still point of a woman the surgical service had decided was nothing. In bed 4, Colonel Walt Brennan had pushed himself up on one elbow against every order his body was giving him, and he was watching, and his face had changed, because he was not watching a hospice nurse anymore. He was watching a captain in a converted chapel with a corrugated roof, 12 years and 4,000 miles back, running trauma with the rounds coming in, calling cycles in that exact flat-carrying voice, and the name came up out of the deep water of his memory all at once and complete. He knew her. He knew her hands because they had been inside him. He knew the voice because it had told him he was going to live when he was sure he was not. He opened his mouth and then closed it, because she was working, and you do not break a working surgeon's concentration, not ever. That was bone deep in him, too. He lay back down, but his eyes did not leave her, and they had filled, and a man who had not wept in 30 years let it run down into the white stubble at his temples without lifting a hand to stop it. They got Howell back. At the 4-minute mark, on the second cycle after the shock, the monitor's chaos resolved into a rhythm, and the carotid had a pulse under Renata's 2 fingers, thin and then steadier, and Howell drew a ragged breath of his own, and the room let out the breath it had been holding since the wrong sound. Renata kept her fingers on the pulse a full 30 seconds longer than she needed to, counting, certain, and only then did she straighten up. She did not whoop. She did not look around for the credit. She said, "Okay," one word flat, and began immediately the next necessary thing, which was the cascade of orders that keeps a barely recovered heart from stopping again. The drip, the labs, the transfer to a monitored unit, the call to the family. If you've made it this far into Renata's story, hit subscribe, because what happens next is the part I've been waiting to tell you. What happened next was that Dr. Adrian Voss came back to the 4th floor. He had been paged when the code was called. A code on any floor pulls the nearest surgical attending, and he arrived 60 seconds after the rhythm came back, which is to say he arrived after the war was over. He came off the elevator at a run that slowed to a walk when he saw the room already under control. He took in the scene as a man like him takes in a scene: the recovered patient, the spent crash cart, the resident Foley standing there bagging with shaking hands, and at the center the nurse he had told 4 hours ago to go hold hands, calmly running the post-arrest orders, and the first thing out of his mouth, because pride is the last thing to read a room correctly, was, "Who ran this code?" He said it as a challenge. He said it as you say it when you assume the answer's going to be a problem. Foley, still bagging, said, "She did," and tipped his head at Renata, and Voss looked at her, and you could watch him decide in real time, that this could not be what it looked like. For a moment, no one answered him, and the moment stretched, and the stretching of it was the whole floor recalibrating in real time. Because every person standing in that ward had just watched the thing happen with their own eyes, had watched the hospice nurse do, calmly and perfectly, the exact thing the credentialed resident could not do at all. And now the senior man was standing there asking the question as though the answer were going to be embarrassing for her, and the gap between what they had seen and what he was assuming hung in the air with a weight you could feel. It pressed on the room as the morning's hush had pressed, but in the opposite direction. That morning the dismissal had moved out from Voss and found no resistance and washed over everyone unopposed. Now it left his mouth and met something. It met Foley's averted eyes. It met Marcus's stillness at the desk. It met Priya Nair's flat, unfriendly stare. It met the plain fact of a man breathing in bed 7 who had not been breathing 4 minutes ago. The dismissal went out from the surgeon as it always had, and for the first time it did not have the room, and you could see him feel the difference and not understand it, like a man leaning on a door that has been quietly bolted from the other side. On whose authority, Voss said, did a palliative nurse run an ACLS code? The ward went cold and quiet again, but it was a different quiet now, because the people in it had just watched what they had watched, and the dismissal that had moved through the room so easily that morning did not move so easily any more. Sister Bernadette took one step forward, but Renata answered first without heat, capping a syringe. On the authority of a man with no pulse, she said, and no one else in the room moving. 7 words and a fact, laid flat on the counter for him to look at. The 2 residents who had laughed that morning were not laughing. Priya Nair was looking at Voss with an expression he did not like, and Voss, who was good and young and could not yet make those 2 things stop canceling, doubled down, because that is what pride does at the exact moment it should kneel. "We'll be reviewing this," he said. "Protocol exists for a reason. You are not credentialed to—" And he did not finish because the old man in bed 4 said one word, and it stopped the room cold. "Major." It was not loud. Colonel Walt Brennan did not have loud left in him. But it carried, as one true word always carries through a room full of noise, and every head turned to bed 4, where the dying old man had pushed himself upright again and was looking not at Voss, not at the residents, but straight across the ward at Renata Hale. And he said it again, and this time his cracked voice found an edge that had been a parade ground command 40 years ago. "Major Hale." Renata went still. It was the first time in 2 years and 4 months that anyone in this building had said that name, and the sound of it landed on her like a hand on the back of the neck, and for one moment, just one, the hospice nurse was not in the room, and someone else was, someone who came to a kind of attention without moving a muscle. The coin was in her pocket. Her thumb found it. "Sir," she said, just that, to a patient in a bed, and the word, and the way she said it, the way her spine had answered before her mind could stop it, told everyone watching that the old man was not confused, was not wandering, knew exactly who he was talking to. For Renata Hale, the word major did something no one else in the room could have measured. It reached down past the hospice nurse and past the 11 years of careful folding and touched the person she had been on the night the roof rang. And for the length of one breath, both women were standing in the same body. The one who counted morphine in tenths and the one who had counted men under a guttering lamp. She had spent more than a decade keeping them separate, on purpose, with care, as you keep 2 volatile things in 2 sealed jars. And a dying man had just, with a single word, set the jars side by side on the counter in front of everyone, and she felt the old self come up through the new one like cold water through a floor, and she did not fight it because it was true, and she did not perform it because she never performed anything. She simply let the name be said and let her body answer it as a body answers a name it has not heard in years, and stood there in her blue scrubs being, for the first time on this floor, visibly the whole of what she was. The coin was warm in her pocket. Her thumb had found it without her asking. Across the ward, Adrian Voss watched the nurse he had told to go hold hands come to attention without moving a muscle, and felt the floor of his understanding tilt beneath him. It was the most exposed she had been in 12 years, and she met it as she met everything, which was by doing the next necessary thing. And the next necessary thing was not to bask in a word, not to turn and look at the surgeon who had been put in his place, not to claim anything. It was to cross the room to the dying man who had said it and find out, at last, who he was. Here is the place where everything you thought you were watching turns over and shows its other face. Up to this moment, the question has been whether a humiliated nurse would be vindicated for a skill the room didn't know she had. But Colonel Walt Brennan was not in bed 4 by accident, and the code in bed 7 was not the random cruelty of a failing heart. Brennan had come to Mercy Branford General specifically, had chosen this hospital, this far from his home for his comfort care admission, because 3 months earlier his old wartime surgeon, dying himself, had told him something that had sent the colonel looking. And what Howell's code revealed in the chart Renata pulled in the next hour while everyone was still reeling was that Howell's cardiac arrest should not have happened, that he had been stable, that the anticoagulation Voss himself had been so impatient about that morning had been quietly, systematically underdosed across the entire palliative floor for 6 months, not by Voss, but by a cost containment protocol someone above all of them had buried in the pharmacy software, a protocol that was killing the patients the hospital had already written off on the floor where deaths were expected, and no one looked twice. The surgeon was never the real antagonist. He was a loud man standing in front of a quiet machine, and the only person in the building positioned to see the machine, because she worked the floor everyone ignored, because she counted in tenths, because she had spent 14 months in a place that taught her that a pattern of deaths is never random, was the nurse he had told to go hold hands. But that comes in its time. Stay in the room a moment longer because the room is still turned toward bed 4, and Adrian Voss is still standing there with the word major ringing in the air he was just filling with protocol. "Colonel," Renata said, crossing to his bed now, and the title came off her tongue with the ease of a language she hadn't spoken in years but had never forgotten. She had not known him by face when she walked onto this floor 2 days ago. The burned, swollen, dying man on the table at the tin church had not looked like this lean old colonel, and the war does not introduce you to the men you save. It just hands them to you broken and takes them away again. But she knew him now. "The tin church," she said quietly, and the old man's face broke open. "Femoral," he said. 9 minutes. You had your fingers in me for 9 minutes. 10, she said, and almost smiled. "But who's counting?" And the colonel laughed, a terrible wet laugh that turned into a cough, and reached out one shaking hand, and she took it. She held his hand on the hospice floor, the thing she had been ordered to do, the thing that was never small, and the whole ward watched a dying officer and the nurse who had saved his life 12 years ago and an ocean away find each other on the worst-funded floor of a hospital the city had forgotten. Adrian Voss did not understand yet what he was looking at, but he had stopped talking, which was, for him, an enormous distance traveled in 90 seconds. He stood at the edge of the room with his residents, and he watched the nurse hold the old soldier's hand, and the silence in him was not the silence of a man defeated, but the more uncomfortable silence of a man beginning, for the first time in a long while, to suspect he had been wrong about something fundamental. He did not yet have the words for it. He went back downstairs, but he took the discomfort with him, and it did not let go. You could measure what had happened in the room by watching the faces of the people who had laughed that morning, because a room recalibrating in real time is its own kind of evidence. The two residents who had laughed the short, embarrassed laugh stood very still now, and the laugh was gone, and in its place was the particular discomfort of young people who have just learned that the senior man they took their cue from had been confidently, publicly wrong, which is one of the most useful lessons a young doctor can ever receive and one of the hardest. Marcus at the desk had stopped pretending to chart. Foley, who had frozen at the foot of Howell's bed and been talked through a bag valve seal by a woman he had been taught to outrank, was looking at Renata with something close to reverence and something closer to shame, and the two would braid together in him over the coming weeks into the beginning of humility, which is the only soil real skill grows in. None of them said anything. There was nothing to say. The word major had been said, and it had reorganized the room the way one true word will, and every person in it was quietly revising 2 years of glances they had given a woman in blue scrubs they had decided was nothing. Priya Nair felt the cold note from that morning resolve, finally into the thing it had always been trying to become, not discomfort, but recognition. She had known. Some part of her had known since the bad night when she watched those hands, since the morning the laugh had not come to her mouth, and now she understood what she had half seen, and the understanding settled into her like a vocation arriving. She would not be able to explain later to friends outside the hospital why a single word from a dying man in a corner bed had changed the direction of her whole career, but it had. She had watched the loud world be wrong out loud, and she had watched the quiet woman it was wrong about simply keep working, asking for nothing, taking no victory, and Priya decided in that moment without drama that whatever that was, she wanted to spend her life learning it. And Sister Bernadette, 19 years on the floor, who had known there was a room behind Renata Hale, and known it was a large one, stood with her hand resting on the rail of an empty bed and felt the door of that room swing open at last, and she was not surprised by what was inside, only moved that the others were finally being allowed to see it. She had waited 2 years for the floor to learn what she had long suspected. It had taken a code and a kernel and a single word. She set down nothing and picked up nothing. She simply watched a truth she had carried alone become a truth the room now shared, and let the relief of that move through her slow and warm, like sun coming back to a cold wall. The story of those 9 or 10 minutes at the tin church came out slowly over the following days, never all at once, never as a speech, because Renata Hale did not give speeches about herself any more than she gloated, and the colonel was dying and tired easily. But it came out in pieces, to Priya, to Bernadette, and built in everyone who heard it the same slow inversion. A convoy had been hit at dusk. The tin church had taken 11 wounded in under an hour, more than it was built for, and then the unit's only surgeon had been struck himself in the second wave, leaving a captain named Hale as the most experienced trauma hand still standing, with the roof ringing and the lights guttering on the generator and 11 men bleeding into the dark. She had triaged them by feel. She had clamped Brennan's femoral with her bare fingers because the surgical clamp had skittered off the table in a blast and there was no time to find it, and she had held it for 10 minutes, talking to him the whole time in that flat, calm, carrying voice, telling him about the lamp on her challenge coin, telling him anything, keeping him present and unafraid until the wounded surgeon dragged himself back to the table and scrubbed in one-handed, and they saved the leg and the man. 8 of the 11 had lived that night. The Army had given Captain Renata Hale a decoration for it that she had accepted in a quiet room and never worn, and the ribbon was folded into the back of her badge to this day, where no one looked, because the 8 who lived were the medal, and the 3 who did not were the reason she never took it out to admire. Sergeant Del Okafor had been one of the 3. He was the one who had asked her, dying to make it the good kind for somebody. And now, on the fourth floor of Mercy Branford General, holding the hand of the colonel she had kept alive on the same night she lost the sergeant, Renata Hale understood for the first time fully that her whole second life, the hospice floor, the morphine measured in tenths, the promises kept to daughters on the road, the holding of hands she had been mocked for that very morning, was the keeping of a promise to a dead man. The good kind. She had spent 12 years making it the good kind, one bed at a time, on the floor where the loud men never came. The coin in her pocket was warm from her thumb. That is the legacy speaking from the dead through the living, the sergeant's last request carried out for over a decade by the hands he had put it in, and not one person who mocked her had ever guessed it was there. Eleanor Shaw's daughter arrived at 11:50 that first day, while the ward was still vibrating from the code and the word major, and Renata met her at the elevator and walked her to her mother's bed with a hand at her elbow and told her, plainly and truly, what to expect and what not to fear. The daughter, her name was Carol, and she had driven 9 hours straight on no sleep, sat down and took her mother's hand, and Eleanor Shaw, who had been kept present for exactly this, opened her eyes and said her daughter's name. They had 6 hours. Renata gave them the 6 hours, managed the morphine so that Eleanor stayed comfortable and lucid in the same breath, which is a needle most people cannot thread, came in quietly to turn her and left quietly so the two women could say the things that take a lifetime to earn the right to say. And in the late afternoon, in the gold light through the west windows, Eleanor Shaw died the good kind, with her daughter's hand in hers and a nurse's promise kept. Carol found Renata afterward in the corridor and could not speak, and Renata did not need her to, and they stood there a moment, and then Carol said the only thing there was to say, which was, "Thank you for not letting her be alone," and went home. None of the residents who had laughed that morning were there to see it. The loud world never is. Now, the machine. When Renata pulled Howell's chart that afternoon, after the colonel had been settled, after the patient had been transferred, after the ward had stopped shaking, she did it because something about the arrest had been wrong in a way she could not let go of, the same way the wrong sound had been wrong before the alarm. Howell had been stable. Stable cardiac patients on appropriate anticoagulation do not generally throw the kind of catastrophic clot that had stopped his heart. And Renata, who counted in tenths and forgot nothing, remembered that Howell's blood-thinner dose had looked low to her 3 days earlier, low enough that she had checked it against the order and found that the order itself was low, and had assumed at the time that someone upstairs knew a reason she didn't. She did not assume that anymore. She pulled the chart, and then she pulled 3 more, patients who had died on the floor in the past 2 months, death signed off as expected, because this was the floor where death was expected. And she laid them side by side on the desk in the back office, and she found the pattern in 11 minutes, because finding the pattern in a row of deaths was a thing she had learned to do in a place that rang like a bell. Every one of them had been under anticoagulated, not wildly, not obviously, just low, 10-15% below the guideline dose, consistently, across different prescribers who had each entered what the pharmacy software recommended as the optimized dose. The software was shading the doses down. On a floor full of robust patients, it might have caused nothing anyone could measure, but on a floor full of fragile, dying, clot-prone bodies, a 15% shave on a blood thinner was the difference between a death that was coming in 6 months and a death that came tonight, signed off as expected, on the floor where no one looked twice. Renata sat in the back office with 4 charts and a cooling cup of coffee, and understood that she was looking at a thing that was killing people, quietly, by policy, that it had been doing it for at least 6 months, and that the reason no one had caught it was that it was hidden on the one floor of the hospital the institution had already decided didn't matter. she did not go to Voss. She went first to the data because Renata Hale had learned the hard way that being right is not enough. You have to be able to prove it to people who do not want it to be true, and institutions, she knew in her bones, protect themselves first and the people inside them second. She spent 2 evenings after her shifts pulling every record she had access to, building the pattern out from 4 charts to 19, documenting each underdose against each guideline, capturing the pharmacy software's optimized recommendation beside the correct dose, time-stamping everything, the discipline of building a thing that will have to survive contact with people whose careers depend on it being wrong. She turned her challenge coin over and over while she worked. Bernadette found her at it the second night and did not ask what she was doing, only brought her a fresh coffee and stood a moment and said, "Whatever it is, you're not doing it alone." And Renata looked up at the old nun, and something in her chest eased, because she had been alone in a back room with a pattern of deaths before. And it was good not to be, this time. It was Priya Nair who became the second censor, the junior nurse who had felt the cold note that first morning and had now seen the hands and heard the word major, and who came to Renata on the 3rd evening and said simply, "Tell me what you found. I want to help, and I'm not afraid of them." And Renata, who did not easily let people in, looked at the 26-year-old and saw something she recognized, the steadiness under the youth, the noticing, and she told her. The 2 of them built the rest of the case together in the back office over 4 long nights, charts spread under the desk lamp, Priya cross-checking each dose while Renata reconstructed the timeline. And somewhere in those evenings, Priya stopped being a resident who had laughed adjacent at a cruel joke and became a nurse who understood what the job actually was, which was the only apology that would ever have meant anything, and the only one Renata would have wanted. The work itself was tedious in the manner of all real proof, and Renata taught Priya, without ever framing it as a lesson, how you build a thing that survives contact with people who need it to be false. You do not lead with the conclusion, she showed her. You lead with the dose. You put the guideline number and the entered number side by side, and you let the gaps speak, and you do it 19 times 20 so that no one can call any single instance an outlier. You timestamp everything, because a fact without a timestamp is an opinion. You capture the software's own recommendation in its own words. Optimized, it said in a tidy green field, optimized beside a dose that was quietly killing people, because the machine convicting itself in its own language is worth more than any accusation a nurse could make. You assume, the whole time, that the reader will be hostile, will be frightened, will have a career riding on your being wrong, and you build the thing so airtight that hostility and fear and self-interest have nothing to push against. It was, Priya realized somewhere around the 3rd night, the documentary equivalent of the flat, calm, carrying voice, the same refusal to give the chaos a handhold, the same insistence on the next verifiable thing, applied to paper instead of a body. Renata Hale ran an investigation as she ran a code. Of course she did. It was the only way she knew how to run anything, by being steadier than the thing that wanted to come apart. There was a moment on the 2nd night when Priya sat back from the desk and said quietly, "If we're right, people died who didn't have to." "Yes," Renata said, not looking up from the chart. "And if we're right and we can't prove it, more will." "How do you carry that?" Priya asked, the same question Voss would never think to ask, the question only another nurse would. Renata set down her pen. "You don't carry the ones you couldn't save," she said. "You carry the next one toward the door. That's the job. The grief is real, but it's not a place you get to live. There's always a next one." She picked the pen back up. Priya looked at her for a long moment, at the silver at the temples, the steady hands, the worn coin on the desk, and understood that she was being handed something that did not come on any curriculum, and she took it, and it shaped the rest of her life. There was a night, midway through the building of the case, when it nearly came apart. Renata went to log in and found her access to the historical pharmacy records had been quietly narrowed. Not cut, just narrowed. The kind of administrative tightening that can be explained a dozen innocent ways and means one guilty one. Someone upstairs had noticed a palliative nurse pulling a great many old charts and had, without saying anything to anyone, begun closing doors. It would have stopped most people. It did not stop a woman who had triaged 11 men in the dark with the clamp skittered off the table. You learn, in a place like that, to work with the tools that are left rather than mourn the ones that are gone. She had already exported what she needed. She had built the spine of it before the door closed, and the narrowing itself became part of the proof, because a system that tightens access the moment someone looks is a system that knows somewhere in its machinery that there is something to find. She time-stamped the access change to and added it to the folder and turned the coin over once and kept going. The man who had closed the door came down to the floor himself 2 days later, which the loud world does only when it has begun to be afraid. His name was Garrett Pyle, and he was an administrator of cost and yield 3 levels above the 4th floor, a pleasant, well-pressed man who had never in his tenure walked the palliative ward, and walked it now with the careful smile of someone visiting a foreign country. He found Renata at the medication cart and introduced himself and made small talk about staffing and the heat, and then arrived, by a route he imagined was subtle, at the point. He understood she had been pulling a great many historical records. He wanted her to know that data privacy was a serious matter, that pulling charts outside the scope of one's current patients could be seen, he let the word hang, as a problem. He smiled when he said it. He was not threatening her. He was a reasonable man explaining a policy, which is the most dangerous thing an institution ever sends, because a threat you can fight, and a reasonable man explaining a policy is the machine itself wearing a face. Renata looked at him with the flat, level calm that had given Adrian Voss nothing to push against, and she said, "I count the dead on this floor, Mr. Pyle. That's the scope of my current patients." 11 words. She did not raise her voice. She did not blink. And Garrett Pyle, who had come down to frighten a handholder back into her lane, felt for the first time the particular cold that comes off a person who has been somewhere you have not and is not impressed by your clipboard, and he did not quite know what to do with it. So he smiled again and said it was good to put a face to the name and went back upstairs. He had learned nothing about her. She had learned everything she needed about him, that he knew that he was watching and that he would protect the policy before the patients, which told her exactly how the rest of it would go and exactly how airtight the folder would have to be. She built it tighter after that. A reasonable man explaining a policy is a clarifying thing to meet. It tells you precisely what you are up against, and Renata Hale had always worked better once she knew the shape of the dark. It cost her sleep she did not have, and a kind of solitude she knew too well. There were nights she sat in the back office until the windows went from black to gray, cross-referencing a dose against a guideline against a timestamp, building the one thing that could not be waved away, and the old loneliness of it sat down beside her like an animal she had fed before. She had done this once already, in a different way, in a place that rang like a bell, held the whole weight of other people's survival in her own 2 hands, while the institution that should have helped was busy elsewhere. She knew the shape of carrying a thing alone. The difference this time was Priya across the desk and Bernadette's coffee at her elbow, and a dead colonel's letter not yet written but coming, and the difference mattered more than she would have said aloud. She turned the coin over. The lamp face caught the desk light, and she kept going, because the doses were wrong tonight, and that was the only fact that set the pace. And then, before the case was finished, the machine took another one, and this time it took her by the throat, because this time she knew, and knowing made it worse. On the fourth evening, while the folder was still 19 charts, and not yet the thing that would stop it, a woman in bed 11 named Sorensen, 74, on the same shaded protocol, began to slip. Renata had flagged Sorensen's dose 2 days earlier and put in a correction request and watched it sit unactioned in the queue because a nurse's correction request on the forgotten floor moves at the speed the institution assigns to the forgotten floor, which is no speed at all. Now Sorensen's pressure was sliding and her belly was rigid, and Renata knew, the way you know a wrong sound, that the woman was bleeding internally from the very overthinning the protocol caused. The opposite failure from Howell, the same route, the machine cutting both ways depending on the body it found. She did not have time to be vindicated. She had time only to fight for a life the system had quietly bet against. She called it up the chain hard and fast, invoked Voss's name and the open investigation to make the loud world move at the speed of the dying instead of the speed of the budget, got Sorensen typed and cross-matched and the thinner reversed, and a surgical consult to the bedside while she held pressure and held the woman's hand and told her the true plain thing in the flat, calm, carrying voice, both skills at once, the trauma nurse and the hospice nurse working the same body in the same breath, which is what she had always been and what no one had ever been able to see. Sorensen lived, barely and not without a transfusion and a hard night, but she lived, and she lived because the one person who had decoded the machine happened to be standing on the floor when it struck again, and because that person could run a hemorrhage and a deathbed at the same time without losing her grip on either. Renata sat in the back office afterward with her hands finally allowed to shake, and Priya found her there and did not say anything, just sat down across from her, and after a while Renata said very quietly, "We have to finish it. Tonight, tomorrow, I don't care how late. Every night it isn't finished. The floor's a loaded gun." And they finished it. It took 2 more nights. But Sorensen's near death went into the folder as the 20th case, the live one, the one that proved the thing was not history but happening, and it gave the documentation a heartbeat the spreadsheets could not argue with, because it is one thing to show a system a column of the dead, and another thing entirely to show it a woman in bed 11 who almost joined them on a Tuesday it could not deny. Adrian Voss, meanwhile, was conducting his own quiet unraveling. He had filed his "will be reviewing this" complaint about the code out of wounded pride that first afternoon, and then the review had happened, and the review had found that the palliative nurse had run a flawless ACLS resuscitation that saved a man's life while a credentialed resident froze, and that there was, in fact, nothing to review except the question of why she was so good at it. Voss was arrogant, but he was not stupid. And stupidity and arrogance, like youth and competence, do not cancel. He started watching her. He saw the families on the floor speak Renata's name as you speak the name of someone who carried you across a river. He heard from Foley, who had not stopped thinking about the 4 minutes either, that the nurse had talked him through a bag valve seal mid-code without once making him feel small, and slowly, against the grain of everything his training had taught him about where the important medicine happened, Adrian Voss began to understand that he had walked onto a floor he did not respect and been outclassed, on his own terms, by a woman he had told to go hold hands. It is a particular kind of education, the kind that costs a man his idea of himself, and Voss was getting it one day at a time, and to his credit, he did not look away from it. The day he understood it fully was the day Renata brought him the charts. She did not go over his head with the anticoagulation pattern, though she could have, and though the system that had hidden it would have preferred she go anywhere except to the one surgeon with the standing to escalate it fast. She went to Voss because he was good, and because the floor needed the action a surgeon's signature could trigger in an afternoon that a nurse's report would take a month to budge, and because, This is the part the loud men never expect from the quiet ones. She did not actually want him destroyed. She wanted the patients to stop dying. So she laid 19 charts on the desk in front of Adrian Voss and she said, "Before you tell me I'm just a hospice nurse, look at these." And he flinched because the line came back at him with the full weight of everything that had happened since he'd said it. And then he looked. It took him 20 minutes to see what she had seen, and she walked him through it without a single "I told you so," dose by dose, chart by chart, the pharmacy software's shaded recommendations laid beside the guideline, the pattern building in front of his eyes until he sat back in his chair and went pale, because Adrian Voss was a good doctor and he had just watched a quiet woman prove that the institution he worked for was killing people by spreadsheet on the floor he had dismissed that morning. "This is," he started, and stopped and started again. "How long have you known?" "6 days," she said. "How long has it been happening?" "At least 6 months, 19 that I can document. Probably more, I can't." Voss looked at the charts and then at the nurse, and something in his face came apart and rebuilt itself into something better. "Why bring it to me?" he asked. And Renata Hale said the truest, plainest thing, the thing that took the last of his arrogance out at the knees more gently than any triumph could have. "Because you can stop it by Friday, and I can't." That was the vindication, and you'll notice no one gloated, and you'll notice it happened with 3/4 of the story behind it, with the room watching. Priya in the doorway, Bernadette at the desk, the floor that had heard the cruel line that morning now, hearing the surgeon ask the nurse how to fix what he had not been able to see. Voss escalated it that afternoon with the full weight of a surgical attending's signature and a folder of documentation a nurse had built so airtight that the hospital's first instinct, to bury it on the floor where it had been buried for 6 months, died on contact with it. He did not soften it to protect himself or the service. He walked it straight into the chief medical officer's office and put the 19 charts on the desk and said the patients were dying of a pharmacy setting, and here was the proof, and he stayed in the room until someone with the authority to pull the protocol agreed to pull it. There was an investigation. The cost containment optimization was traced up through the pharmacy software to an administrator 3 levels above the floor, a man named Garrett Pyle, who had implemented it to shave a margin, who had never once walked the 4th floor, who had decided in a meeting that the deaths of the already dying were an acceptable place to find efficiency. He had a spreadsheet that called it a low acuity yield adjustment. He had presented it with a slide. The protocol was killed. The doses were corrected hospital-wide within 72 hours. Nobody could ever say how many of the 19 would have lived longer or how many future deaths the correction prevented, because that is how it is with the quiet machines. You cannot count the people a fixed thing doesn't kill. The justice was real, and it was not clean. Garrett Pyle resigned with a package rather than face anything that felt like a reckoning, and walked out of the building into another job at another system, and the floor stayed underfunded, and the loud world went on. But the doses were right. The patients stopped dying of policy. And on the floor where nothing happened, the woman who counted in tenths had made the difference, again, as she always had, without anyone clapping. Renata felt about the resignation the way she felt about most things the loud world did. A flat, clear-eyed disappointment that was not the same as surprise. She had told Priya early on what would probably happen, and it had happened. "Systems don't fix themselves," she said the night the package was announced. "People fix things. Then the system finds a way to call the fix a cost." Priya, young enough to still want the cleaner ending, asked how she could stand it. Renata thought about it a while. "Because the doses are right tonight," she said. "Mr. Howell is breathing tonight. You don't get the clean ending. You get the next necessary thing, so you do that." And she turned the coin over once and went back to the floor. Colonel Walt Brennan lived 11 more days. Renata Hale nursed him through every one of them, and they talked in the long, quiet afternoons, the way two people talk who have been to the same terrible place and come back. Not about the war, mostly, but around it, the way you circle a thing too big to look at directly. He told her things about that night she had never known, the view from the table, what her voice had sounded like from inside the worst pain of his life. "You told me about a lamp," he said, "on a coin. You kept telling me about this lamp." "I needed you to listen to something that wasn't your leg," she said. "It worked," he said. "I'm still mad about the leg, but it worked." She told him about Del Okafor and the good kind and the promise, and the old colonel wept again and said he'd be proud of what you did with it. And she had to leave the room for a minute, which was the only time in this whole story that the still point of Renata Hale came undone. And she came undone in the supply closet where no one could see, with her back against the shelving and her hand pressed over her mouth, and then she washed her face and went back and held his hand. They had a kind of routine, those 11 days. He was a soldier, and he liked a schedule even at the end, so she gave him one: the morning light, the window cracked for the air he liked, the coin set on his bedside table where he could see it because he had asked to be able to see it, the lamp face out. He would turn it over with one finger the way she turned it with her thumb, and some afternoons he would tell a story about a man whose name was on a wall somewhere, and some afternoons he would just hold it and look at the light. On the 7th day he said, out of a long silence, "They've got you on the wrong floor." "This is the right floor," she said. "I know," he said. "That's what I mean. They think it's the wrong floor. They've got it backwards." And that was the whole of it. The entire inversion the loud world gets wrong, said by a dying man holding a brass coin to the light, and she did not answer because there was nothing to add to a thing that was simply true. On the 8th day, in the long, flat heat of the afternoon, he wanted to talk about the three who hadn't lived. She had not expected it, and she did not flinch from it, because she did not flinch from the things that mattered, only stayed quiet about them. He had carried them too, it turned out, the men from his own side of that night, the ones the captain had lost while she saved him. He named them. She named the ones she could. And in the naming, something that had been a stone in each of them for 12 years did not dissolve. Exactly, because that kind of stone does not dissolve, but it was set down for an hour between two people who had been in the room when it happened, and that was a mercy neither of them had ever been given before. "You couldn't have saved all of them," he said. "I know," she said. "That's not the same as not wishing I had." "No," he agreed, "it isn't." And they sat with that, the truest hard thing, the colonel and the major, the saved and the saver, on the floor the loud world called a departure lounge, and the gold light moved across the wall, and a sergeant named Okafor was remembered out loud by the two people left alive who had loved the way he died asking for mercy for other men. It was, Renata thought afterward, the most honest hour she had spent in 12 years, and she had spent it holding a hand on the floor where nothing happens. He slept a great deal after that, as the dying do, letting go of the rope a little at a time. She kept the coin where he could see it. She kept the window cracked for the air he liked. She kept her promises, which is the only liturgy she had ever needed, and the days narrowed toward their end as they do, gently, with the light. On the 9th of those 11 days, Brennan asked Priya for paper and a pen, and with a hand that could barely hold it, he wrote something and sealed it in an envelope and made Priya promise not to give it to Renata until after. "After what?" Priya asked, though she knew. The colonel just looked at her, the look of a man who has filled out enough forms about enough deaths to be done with euphemism, so she kept the envelope in her locker. And on the 12th day, when Colonel Walt Brennan died the good kind, in the afternoon light, the window cracked for the air, the coin on the table catching the sun, with Renata's hand in his, unafraid exactly the death a dying sergeant had once asked a captain to make possible for somebody. Priya waited until the body had been taken down and the bed stripped and the floor had gone quiet, and then she gave Renata the envelope. Inside, in the shaking hand of a dying officer, it said, "Major Hale, you held my leg together for 10 minutes, and you held my hand for 11 days, and I have decided the second was the braver thing, though no one will ever pin a ribbon on it. I came here looking for you, our old surgeon. You remember him. You dragged him back to that table, told me before he went that the best trauma nurse he ever served with had disappeared into hospice work, and that he never got to tell her she'd done right. He was right, and so am I." They look at you and see a handholder. I looked at you and saw the whole war stand up straight. There's a thing killing people on this floor. I felt it in the air the way you feel incoming. And I think you're the one who'll find it, because you're the only one who counts the dead instead of filing them. Wear the ribbon someday or don't. You were always the rank, with or without it. Brennan. Renata Hale read it standing at the stripped bed in the afternoon light, and she did not cry this time, because some things go too deep for that, and she read the line about the thing killing people on the floor twice, because the old soldier had smelled it before she had confirmed it, had come here dying on the strength of a hunch and a dead surgeon's regret, and had been right on both counts. She folded the letter once and put it in her left scrub pocket beside the coin, and stood there a moment with her hand over both of them, and then she did the next necessary thing, because there was another patient down the hall, and the work was the point, and the credit was somebody else's problem, and it always had been. Adrian Voss came to the floor the next morning, not for a discharge, not for a patient, but to find Renata Hale, and he found her at the medication cart where he had insulted her 3 weeks before, and he stood there a moment the way a man stands when he has rehearsed something and lost the script. "I owe you an apology," he said finally, "and I'm not going to insult you by making it a long one." Renata looked at him. "You don't owe me anything," she said. The patients owed somebody. You paid it. And Voss, who had learned more in 3 weeks on a floor he'd dismissed than in 3 years of being the best hands in the building, said the thing he had actually come to say. "Teach me," he said, "the hand-holding, the good death thing. I don't know how to do it, and I watched you do it for a man you saved twice, and I want to learn." And that, not the salute, not the word major, not the letter, that was the moment the room finished turning, because the loudest man on the surgical service had just asked the quietest nurse on the forgotten floor to teach him the medicine he had mocked, and meant it. She taught him, not all at once, and not as a victory. There was never any victory in it for her, only the work. But over the following months, Adrian Voss started coming up to 4 on his own time to learn from Renata Hale how to sit with the dying, how to find the true plain thing and say it, how to titrate not just the morphine but the presence, how to keep a promise to a daughter on the road, how to stand in a doorway and read which patient the night was going to take. He was bad at it for a long time, the way the credentialed are bad at the thing they were never taught to value, too fast, too full of fixing, reaching for an intervention when what the moment needed was a chair pulled up and a mouth kept shut. The first lesson she gave him was the one that nearly broke him, because it was the opposite of everything that had made him excellent. "You walk in to do something," she said, watching him fidget at the foot of a dying man's bed. "Stop. There's nothing to do. That's the whole skill. Sit down and do nothing with your whole attention." He sat. He lasted 90 seconds before he reached for the chart, and she took it gently out of his hands and set it on the floor. "Him," she said, nodding at the patient, "not the paper. Him." It was, she told him later, the same thing she had learned in reverse 12 years ago and 4,000 miles away. That in the trauma bay, the skill is to do the next necessary thing without a wasted motion. And on the hospice floor, the skill is to know that the next necessary thing is, very often, Nothing at all but your presence, fully given. Two ends of the same instrument. She had spent her life learning to play both. The surgeon had been handed only one and told it was the whole orchestra. He was patient taught and humbled, week by week. She was patient with him, the way she was patient with the frightened and the failing, because that was the whole of her gift. The first time he got it right, sat with a man who had no family and no time and simply stayed and found the one true thing to say, and said it, and watched the man go out unafraid. He came out into the corridor and could not speak, and Renata handed him a cup of bad coffee and said, "Now you know." And that was the entire ceremony, and it was enough. He kept coming after that, not as penance and not as a project, but because he had discovered, late and at the cost of his idea of himself, that the floor he had called a departure lounge was where the hardest and most human medicine in the building was practiced, and he wanted to be, before he was finished, the kind of doctor who could practice it. The loud man had gone quiet, and in the quiet he had finally begun to hear the floor, and the residents who had laughed that first morning grew up into doctors who knew, because of what they had seen on the fourth floor, that there was a kind of medicine that did not announce itself and was harder than any save, and they carried that into every floor they ever worked, which is the only kind of legacy that outlives a single quiet woman. Foley kept in touch with her for years. He sent her a note the day he ran his first code clean on a different floor in a different city, and it said only, "Two-handed seal, watch the chest rise, thought of you, thank you." She kept that one too. Priya Nair stayed on the palliative floor. She had come to it as a rotation, and she chose it as a life, and years later, when she ran the floor herself, she would tell the new nurses the story of the morning a surgeon told a hospice nurse to go hold hands and the dying colonel in bed 4 who stood up and called her major, and she would tell them to watch the quiet ones always, to watch their hands when it gets bad, because the loud world is wrong about where the strength lives almost every time. She kept a copy of the underdosing case in a drawer, not as a trophy but as a template. This is how you build a thing that survives contact with people who need it to be false. And twice in her career she pulled it out and built another one, and both times patients she never met went on breathing because a quiet woman had once taught her to count the dead instead of filing them. Sister Bernadette retired the following spring, and on her last day she found Renata at the supply room and said in her dry way, "I always knew there was a room behind you." "There was," Renata said. "Was it a large one?" the old nun asked. Renata thought about the tin church, and the 8 who lived and the 3 who didn't, and the femoral artery under her bare fingers, and the call sign lantern, and the good kind, and the floor where she had spent 12 years keeping a dead man's promise one bed at a time. "Large enough," she said, and Bernadette, who had been a nun and knew an honest answer when she heard one, nodded and let it be and went home, and the floor got a little quieter for the leaving of her. There was no ceremony at the end of any of it, because that is not how the quiet work resolves. No one pinned anything on Renata Hale. The hospital, having corrected the doses, did not particularly wish to dwell on why they had needed correcting, and so there was no plaque, no notice in the newsletter, no moment where the institution stood up straight and admitted what a woman in blue scrubs had caught on the floor it had written off. The reckoning was real and it was incomplete, the way reckonings are. Garrett Pyle landed softly somewhere else. The floor stayed underfunded. The loud world reassembled itself around the small hole the truth had briefly torn in it, as water closes over a stone. And Renata Hale, who had never once done any of it for a plaque, felt about that exactly nothing, because she had what she had always worked for, which was a floor where the doses were right and the patients went out the good kind, and that had never required anyone's applause and did not require it now. What she had instead, she kept. She had Howell, who lived another year and a half and sent a card each Christmas in a shaky hand. She had Sorensen, who walked out of the hospital on a daughter's arm and did not know, would never know, how close the machine had come, and did not need to know, because the not knowing was itself the gift. She had Carol Shaw's 6 words in a corridor. She had Foley's note about a 2-handed seal. She had Priya, who would carry the whole of it forward into a career Renata would not live to see the end of. And she had a letter in a dead colonel's hand that said she had always been the rank, with or without the ribbon. It was not the kind of reward the loud world recognizes. It was the only kind she had ever wanted. Renata Hale still works the palliative floor at Mercy Brantford General. She still counts in tenths. She still keeps the promises the loud men never know are being made. The ribbon is still folded into the back of her badge, unworn because the 8 who lived are the medal and she does not need it on her chest to know what she is. But she added one thing, after Brennan. She took the colonel's letter and she had it framed, small, and hung it in the back office where the nurses chart, not where the families or the surgeons can see it, just where the people who do the quiet work can find it on a hard night. And under the frame, on a small brass hook she put there herself, she hangs her challenge coin at the end of each shift, the worn lamp face out, so that the next nurse who comes in at 3 in the morning to a floor full of the dying can see it catch the light and know that someone steady has done this before them, and that the holding of a hand is not the small thing the loud world says it is, but very nearly the largest thing there is. There is a nurse on that floor now, newer even than Priya once was, who came in on her first overnight shift terrified and alone at 3 in the morning with a hallway full of the dying, and no one loud left in the building to ask. She found the back office. She found the small frame letter she did not understand, in a dead man's hand, addressed to a major she had never heard of, and she found under it a worn brass coin on a brass hook, a stylized lamp on one face catching the low light, and though she did not know the story and would not for years, something in her steadied at the sight of it, the plain physical fact of it, the evidence that someone had stood here before her, at this hour, on this floor, with this exact weight, and had been equal to it. She took a breath. She turned the coin over once with her thumb, the way she had seen the senior nurse do without ever asking why, and she went back out to do the next necessary thing. That is how it passes, the quiet kind of courage, not in a salute, not in a ribbon, but hand to hand in the dark, on the floor no one looks at, from the steady to the frightened, one turned coin at a time. Some people spend their whole lives making sure you see how much they matter, and some carry a war folded into the back of a badge and answer to a call sign only the dying remember, and do the hardest medicine in the building on the floor no one looks at, and let you call them nothing right up until the moment you need everything they are. So here is the question I'll leave you with, and there is no clean answer to it, only the one you would actually live. When the loud man speaks over the quiet one in your own room, the meeting, the family, the floor where the real work gets done, would you laugh along because it is easier, or would you be the one who watches her hands? Tell me which one you have been, and tell me which one you mean to be.